From Rectangle Health, this is the Modern Practice Podcast, a show that provides you with fresh perspectives and practical advice from industry experts in the ever-changing world of healthcare technology. Every episode, we tackle a timely topic to help you stay current and simplify the business side of healthcare. Without further ado,
welcome back to the Modern Practice Podcast, everyone. Before we get into today's episode, I want to take a moment and thank you all, our listeners, for all the support and feedback you've given. This show launched less than a year ago, and the growth has been incredible. And as always, if you like what you're hearing, leave us a review on Spotify. And if you'd like us to cover a specific topic in healthcare, leave a comment or message us. We appreciate all the support and love you've shown. And all right, without further ado, really excited to have this guest back on the show. He is James Swan, Senior Director of Enterprise Solutions at Rectangle Health. James, welcome back. Thanks for taking the time.
Yeah, I always appreciate the platform, Gary. Excited for today's discussion.
Pleasure's all mine. And before we dive in, are there any trade shows or events coming up? Where are you headed?
Yeah, there's always a few trade shows, but the few things kind of on the short radar, we've got Dykema in Denver in July, and then we've got a couple other shows. We've got the Dental Forum in September. We've got the DSO Technology Summit in September, and then ending off the year, at least in the short term on my calendar right now, I think we've got the DSO Leadership Summit in Austin as well. So a couple really exciting shows coming up here in the next few months.
Awesome. What I'll do is I'll go ahead and drop a link to those events for our listeners to get more details. And by the way, if you haven't connected with James on LinkedIn, I strongly recommend you do. He is a wealth of knowledge.
I really appreciate that, Gary.
No problem at all. All right, let's dive in. James, the last time we spoke, you mentioned something that really intrigued me: single sign-on. It's a buzzword in healthcare. It's a buzzword in many industries. What is it? Why are we hearing so much about it at this point in time?
Yeah, and single sign-on's been something that's been building steam and starting to really pick up kind of the idea of what it is and how it's beneficial. And the idea of single sign-on is this idea that we're able to do more with less, and being able to allow somebody at one location or their kind of role, if you will, to sign on to one technology and then allow them to interact and go through their day-to-day activities without needing to log into disparate platforms and multiple different setups. And the idea of single sign-on, what it does is it just creates efficiencies for those end users such that they're not having to bounce between platforms and having to remember different usernames, passwords, all those uniquenesses as we're working out potentially of disparate technologies. So single sign-on's really sole purpose and sole goal is to minimize friction for that end user to maximize efficiency and output.
So for practices and organizations that haven't moved to a single solution, I think you touched on this, but are they layering software over software, kind of going old school and doing it all manually? I'd imagine that's just not cost effective and makes it harder on staff. There's learning curves and transition times as they onboard new staff.
Yeah, and this idea, single sign-on and consolidation, I suppose can be kind of looked at almost interchangeably. And this idea of multiple technologies and layering is one that in the last, we'll call it 3 years, when there's been just this boom and growth, a lot of organizations have found themselves layering these technologies just because they were in this growth mode and this idea that we wanted to grow so fast that it wasn't necessarily important to remove old technology. And what that is now showing is kind of organizations are starting to look under the hood and start to really focus in on how do we sharpen for that next stage of growth. What they're doing is they're looking at technologies that can do more. And when we think about a solution like Rectangle Health and the idea of single sign-on, the goal really is to where can we provide efficiencies across your varying PM systems, if you've got multiple or even just your single PM system, to be able to improve efficiencies, drive those additional outputs, provide benefit to your end users, but also provide benefit to your patient set. So to answer the question, I think that there had been a lot of layering technologies. And right now we're in kind of this phase of the growth in which organizations are looking to really tighten their tech stacks to be able to go into that next phase of growth go forward.
You speak to the practices and organizations every day. And I think you already mentioned that as well. How often are you hearing we need a single consolidated solution? Is it at that point where they've got so many things going on, in the day to day, managing these practices, these organizations, maybe not in the words, we need a single consolidated solution, but how often are you hearing what is the demand for one sign on, one consolidated platform?
Yeah, it's huge right now, and really this implementation fatigue is a phrase that I've heard quite a bit. And rewind about a year ago or 6 months ago, it was a few other terms, but this implementation fatigue, what it is there's more technology that's able to enhance and drive those efficiencies than ever before. But right now, if we're layering on different technologies, what that's doing is it's really coming at the expense of the staff and potentially coming at the expense of bringing in or having these new features and functions. And when we're able to look at a singular tech stack, which offers single sign-on, what we can do is kind of go at that at a unique pace, because we can open everything up through that single sign-on experience and then slowly roll features and functions out that are critical to the everyday business of an organization without needing to kind of absolutely bombard them day one. So the idea of single sign-on really does impact those end users and that implementation fatigue component, because it's already an interface and a view that they're used to. It's just potentially providing additional automation or efficiencies to impact their daily lives.
And what parts of that day to day are they most looking to improve?
Yeah, I think it's the idea that we're trying to improve how we communicate with our patients. And in doing so, we're finding that by communicating via text and automating some of those other outreaches to patients, we're reducing the workload and the requirements of those staff members at the front desk. And what that's allowing for is no longer our end users, or excuse me, our staff members buried into their computers. They're able to look at these patients and have that genuine dialogue to improve patient experience, because we're leveraging technology in the background through single sign-on platforms to drive efficiencies while allowing our employees to manage those day-to-day encounters, improving patient experience, improving the way patients can communicate with our practices, but also leveraging technology in a way to do it that is impactful across the gamut.
So let's paint a picture here if we could. And if we could do that for both a single practice or multi-location organization, what does the day-to-day look like post consolidated solution implementation once they've brought it all in under one umbrella?
Yeah, for when we think of kind of looking at a single location, the most important thing is there's more technology in the space than maybe ever before. And what we can do is we can, to your point, layer these technologies in to create a near perfect experience. But what we find is day one looks very different than day 90 or day 160 or 180 or whatever we want to say. And why that is there is some fatigue in those systems and platforms that get used seemingly on a daily basis or a weekly. And when we have 7 different platforms and 7 different experiences, our staff members are in many cases going to leverage the things that are easiest. And when we think about taking that then to the next step and going to a multi-location organization, when we don't have a view potentially of everyday experiences and the workflows of every day, that potentially even becomes more of a disparate technology stack. And we may have the best of every single platform, but if every organization is not leveraging it the same way, we're really not going to be able to see the true benefits of those things. And when we think about a single sign-on tech stack platform like Rectangle Health and our Practice Manager Bridge platform, the goal is really threefold. We want to improve the patient experience through optionality. We want to give automation to the end users, which is going to streamline and enhance their daily output. And then on the back end, we want to give consolidation, scale, and the ability to grow faster than ever. And if we can achieve those 3 buckets from a single sign-on tech stack, we're going to have a lot of really, really happy partners, because we're able to impact all 3 phases of what additional technology should be leveraging or should be impacting for these multi-location organizations.
So you've sold me on the benefits of single sign-on. What's the icing on the cake as far as functionality, capability within the software? that a practice or an organization may not think about, but they kind of have these aha or wow moments when you share those with them.
Yeah, and it's not only is the functionality going to be like for like potentially when you're layering on these best in class solutions, but if we're able to do it in a single sign-on tech stack, we're able to bring economies of scale into the equation. And why that's important is when we look at, again, layering technologies, it quickly becomes very expensive. And in doing a single sign-on platform, which encompasses all of these different best in breed platforms and best in breed options for our patients, best in breed automation for our end users, and then best in breed consolidation and scale for our organization. If we can do that all through one platform, creating those economies of scale, all we're going to do is improve our bottom line, increase EBITDA, and ultimately have a better working experience for everybody across the way. So the icing on the cake is almost this idea that the aha or the wow moment is that one organization can achieve and accomplish all these different features and functions that a lot of our partners are looking at through 5, 6, potentially 7 vendors to achieve all the things. So the aha is really this idea that one single platform can achieve all of their different goals, demands, and hopeful outputs for the technologies that we're talking about today.
It's really amazing. And I think what it does also is, you still have staffing shortages and high employee turnover rate. That learning curve shrinks. It's easier to train. It's less costly to train. More efficiency is produced in ways that not often thought about. So really amazing stuff there. And before we wrap up, I wanted to ask, as I did last time you were on the show, since it's been a while, you obviously have a passion for helping practices and organizations treat more patients. I see it in your other interviews, webinars, and trade shows. It's really visible. What are you most excited about, or what do you think, as far as technology goes in the business of healthcare, is going to be, or currently is, the game changer for increasing revenue, helping a practice or organization really thrive and grow financially, and most importantly, treat more patients?
Yeah, it's a couple of things. I think that the most exciting thing go forward is really as more organizations adopt these technologies, all that's going to happen is they're going to continue to create these efficiencies internally, and the training and creating those super users for their own organizations is simply going to explode around how do we organically improve the bottom line through improving our financial collections options, improving the ability to treat more patients through some of those automated experiences and technologies that we can bring to the table. And it's just going to provide a better experience from start to finish for everybody involved. But it's really just this idea that one singular technology can be specifically curated for each and every location, even within a single organization, because we all know every practice, even within a single organization, they all might run slightly different. So we're not trying to fit a round peg into a square hole. We specifically curate an experience for each and every organization, and that will inevitably improve exactly like what you were referencing. Thriving of those organizations through financial growth, but impacting it and positively impacting more patients on a daily basis.
Interesting and exciting stuff, James. Can our listeners contact you directly to get more information?
Absolutely. Like you said at the beginning of the show, message me directly via LinkedIn. Contact me directly via my email at jswan with 1 N at rectanglehealth.com. Always appreciate connecting, engaging, networking, whatever anybody would like to do. I'm more than happy to accommodate and look forward to the opportunity.
Awesome. Again, I'll have that link to James's profile in the episode description below. And I highly encourage you all to check out his first episode on the Modern Practice podcast. If you missed it, that episode is loaded with great insights and information. I'll have a link to that episode in the description as well. James, thank you again for coming back to the show and chatting with me today.
Always a pleasure to do it. Hope we get an opportunity in the future to take on the next iteration. Thanks, Gary.
My pleasure, and we absolutely will. One final note for everyone again: if you enjoyed this episode, if you like what you're hearing, leave us a review on Spotify and let us know what you'd like to hear discussed on the next episode. Thanks again for tuning in. Till next time, everybody.
Thank you for listening to the Modern Practice Podcast. If you enjoyed today's conversation, subscribe on Apple Podcasts, Google Play, Spotify, or SoundCloud for new episodes. And follow Rectangle Health on social media for more helpful information, news, and event details. Thanks for tuning in.